Good morning. Today I am excited to share the document I created in Lucid Chart. This document is a flowchart designed to help students understand how cardiovascular drugs work in the body. So what we've created is a basic flowchart. I actually find that the flowcharts are my favorite feature of Lucid Chart. Recently, I've had the opportunity to make a few flowcharts as part of administering my program, and I find there's not good programs out there for creating flowcharts. Generally, I'm not much of an online charting person, but I did find this pretty intuitive and easy to use. So this chart breaks down the various steps that the body goes through that blood pressure medications can interact with the body. So we see here, we have the beginning of the situation where low blood pressure is detected. It activates a system in the body called the RAS system. And then a substance called renin is released. We get to our first decision point there, determining if ACE inhibitors, which are a type of drug, is present in the body. If they aren't, we continue up the top. If they are, we go down the bottom. We see that the blood vessels relax and blood pressure lowers, leading us to our first possible conclusion to the flow chart. If they are not, we see angiotensin 2 is released. If there are drugs called ARBs that specifically block that, then we see that the next drug is not released and that potassium is retained and salt and water is released. Now, potassium is retained leads us to our first interactive activity on this. I already got a result in there, but we'll go ahead and preview results. We can see I've already answered this. I was testing it. This leads us to a question: what medications interact with ARBs because of this outcome? So because potassium is retained, the answer to this one is A, where potassium supplements will interact and raise potassium levels in the body. If we follow down the other side, we see if those ARBs are not present, we lead toward this and we see an increase in the blood pressure, which would be important for if someone actually had low blood pressure and we were not trying to prevent that. We would want no drugs present and blood pressure in that patient would go up. We also have an attached activity here, which is a classification sorting. So we have the sticky notes with the various drugs, and students can drag them over to where they go. So we have our sartans and our prils. Students always try to learn the classes associated using the last few letters or the drug stem. So this helps encourage that activity. This is an activity I would share with my students to help them learn their drug words for the week and to help them understand how those drugs work in the body. Thank you so much for your time.